All right, guys. I will say this later, but this is my disclaimer that any and everything I say is purely based on my own opinion of how the day went. Um, these are not word for word answers from Dr. Garramone. You can't take anything I say in here and say that he said any of these things. They're my opinion from the consult that I had with him and how I reinterpret those interpretations of his answers to the questions I presented him with. All right, that's my disclaimer. Yeah, okay. Watch the video. Hey YouTube, it's Aiden here. I'm making this video to catch you guys up on my my consult with Dr. Garramone. I was able to do an in-house consult, so I was able to actually meet him. It went really, really well. We took the long drive there, and I had brought him a t-shirt from 0.5cc. I'll put it at the end of the video. And I had also brought him cupcakes with his little logo for his, I guess, his surgery center. You know, he really liked the cupcakes. I got him to take a picture of me with the shirt, which was awesome. My thing's gonna die. So it was pretty cool, and he's just really down to earth. At the end of the consult, sorry guys, let me just get this over with. Alright, so at the end of the consult, I had shook his hand, thanked him, and I said, you know, you're everything that everybody always says, you know, your hospitality is amazing. He's just really cool, down to earth. Literally, he's just a cool guy. Just like everybody always says, that's pretty much exactly how he is. You know, he asked me some questions about binders. You know, he's trying to get some information, you know, just more about how we live our lives, which is pretty cool because I think, you know, he'll be able to help us even more through just knowledge, having his knowledge that when he talks to people about what he does, you know, he can teach everybody else too. I think it's cool that he's interested in even knowing about us as people. So, on the more stricter side, the more business side, when you actually get there, in order to book it, you have to put $500 down. Because I had the money, I just wanted to pay everything up front, and you actually only have to pay $4,600 to Dr. Garramone's office, and then you pay the other $1,300 when you arrive at the surgery center that day, which I didn't know about, which is cool. I mean, I still have the money, you don't touch it or anything. I kind of wanted it out of my account so I don't have to look at it, but it's good to know for you guys because like for me, I didn't even tell you guys, I don't think. The date is the 19th of July. It's also my wife's birthday, so she's being a amazing woman by letting me kind of have that day. So all you really need is $4,600, and then you can wait. Like I have just under 90 days, 80-some days, 85 days, I think, or something, to pretty much gather the other $1,300, or you know, if you don't have it yet. So I think that's kind of cool. If you gauge it for a couple of months in advance, you know, you have that extra time, but you can still get a date, and you can still, you know, have him paid off and not have to worry about such a large sum. So yeah, I gave him all the stuff, and then one thing that's pretty cool, which I kind of like, I like when people are fun and they're, hey, what's up? You know, they can kind of bullshit with you for a little bit, but then they get right into business. He's very serious about his work, so he kind of turns his knob from, hey, you're my friend, to, all right, I'm your doctor, and, you know, you're my patient, which I like personally. I like having that really definitive line of when you can be friends with someone and when you have to talk about a serious matter with someone. So, you know, I got right back down to him. I mean, pretty much just sit in the chair. And by the way, like, everybody watches those videos and the room looks really big, but it's really not that big. Like, when I walked in and I looked at it, I said, oh, is this like the room? And my wife's like, yeah, this is the room. And I'm like, wow, it's kind of small. when you see the videos, it always looks like really big, or at least that's how I interpret it whenever I see videos, and it's no bigger than, small bedroom. It was just funny because I thought it was gonna be so much bigger. Okay, so he has to change into a gown, front open. Very privately, he has a doctor come in. Obviously, so you can't say he did anything because he has a witness. But she doesn't. She's looking out the window, not paying any attention too much, at least not with her eyes. And he just stands in front of you, opens your blouse up, does some measuring, just very respectful about it, writes down his information, closes you back up, and then he brings you in front of the mirror and he tells you where he's going to make incisions, and stuff like that. So now to the question part. I pretty much let him talk the whole time. I wasn't going to ask questions till the end, obviously, because he'll probably answer a lot, in which he did. But I did notice that I had about 12 questions. Like 8 of them were after surgery care questions. So I waited. I'm going to wait for those questions until after, obviously, my post-op appointment. I'll have my whole list, and I can kind of, get that information, because I didn't want to waste time. It's pointless to ask after surgery when I don't even have the surgery. I'll probably forget anyway by then. So, some questions I did ask. Okay, so there's only a couple. I'll have a lot more post-op questions that I asked later on. And so first question. Well, first of all, he said that I shouldn't really have doggy ears. Oh, you know what? Sorry, this is kind of out of the norm. I was supposed to put a disclaimer at the beginning. All right, I'll just edit it. Okay, so doggy ears. He said I won't have doggy ears. I had asked him pretty much. I asked him, is it good to be muscular and skinny, or does it not matter if you're a little overweight or if you're muscular or skinny? He said it really doesn't matter too much. I kind of hurt a little bit to hear that, but then he backed it up with, if you're more fit and lean, he has a better gauge as to where to put, the boxy chest shape, where it should curve up, and if he can only cut certain lines, but I'll get to that. But pretty much, it's just more aesthetically pleasing directly after surgery, because you see results quicker, he said. If you're a little overweight and then you get surgery and then you lose weight, you see your results after you lose the weight, that really masculine chest that I'm really trying to accomplish. So, he said it doesn't quite matter, but it's always aesthetically for him, he likes to see the results right away. And so do we. So he said, to be leaner and to be a little more muscular in the chest is going to be a little better, because you're going to see the results and you're going to get that boxy, nice, really masculine chest right away. So that was the one question I asked. The other question I asked was about where he makes the incisions. He makes the incisions exactly where the bottom of your breast tissue ends. He can't make them any higher and he can't go any lower. He has to make them pretty much where your body says to make them, to an extent. So he said that, I asked him, do you have to get so close? Do you have to, how some people have scars that go in the middle and then go out? Okay. I asked him why some people have to connect. He said, the wider your breast is, the wider the skin and all the tissue is, the more chances you'll have, if he doesn't connect them, you're going to have overlay of skin right in the middle. So right here, you're going to have a little overlay of skin right here where they connect. And then he said that, same thing with dog ears. Okay, so if it goes way over, if your breast tissue goes from the middle all the way to the out, then that's where he has to make a slightly other incision so that he can make them real smooth. Okay. So with me, my breast tissue starts over. I mean, obviously you don't see it here. So he doesn't have to connect, which is cool. Then I asked him, well, can't you just make the incision a little closer over here? And he said he gets that question a lot, and that he can't, because again, he gets to choose, but he doesn't at the same time. He has to do what has to get done. There's a saying in baking where people always say, oh, how long does it take? And you always say, it's done when it's done. Yeah, but how long? when it's done. Sometimes a cake can take 45 minutes. Sometimes it can take an hour and 20 minutes. It just depends on so many different factors. So pretty much the way I took it was that he makes the decisions where he has to make the decisions. He can't change it. He does what he has to do to be a good doctor to you and to get that aesthetic look you really want. So that was cool. And then I asked him like just a little bit of pre-op stuff, like when should I stop drinking, and all that type of stuff. I asked him about nipples. If you get any feeling back, he said that you probably won't. I said what I said was, you think it'll be like just if you touch here? And he said yeah, and he said he thinks it's a lot like the mind, like. I can imagine if somebody's touching my nipple after surgery, it'll probably feel a little more intense mentally because I'll know, oh wow, like that's a sexual thing. So I think that's where the how far in advance the nipple feeling goes. Some people have amazing results and some people don't. So you fall anywhere in that category, probably somewhere in the middle. And I think I mostly asked him about scar placement. I told him that scars were like my #1 top thing, and he said that's what most guys' concern is. I just kind of asked him about that type of stuff. I have a lot of after surgery things, like when can I start drinking? Should I just not drink for the whole 4 to 6 weeks? About running after and doing any type of cardio and vitamins I should or shouldn't take. All that random stuff. Should I stop tea before or after? All that stuff. So yeah, I'll have a lot more questions for from the post-op and from the pre-op appointments, because I'll have a couple of questions for each one of those appointments. But overall, it was really good, really cool time. I'm really excited. It's funny though because it doesn't really sink in yet. I'll probably make a video about that maybe next week. But yeah, it's like 80 some days away, and I'm excited, and I feel very blessed that I have a wife who's nice enough to I'm going to try to do something special for her that day, but to kind of give up her one little day a year to celebrate with me. So yeah, I will make a video probably on those feelings as time comes. I'm sure I will have many feelings, because if you don't know me yet, I have many of those. Alright guys, I think overall it was an awesome experience, and thank you for all your good lucks and congrats and all your kind words. I always love them. Really appreciate our community. Alright guys. Peace.